Good evening, everyone. My name is Barbara Adrienne Rosen, and I have been researching Lyme disease for about half a year. I actually started doing this work by I was job hunting, and a blog site came up called Hub Pages, and I like to write, so I started a blog site called We Are the Ones. From We Are the Ones We Are Waiting For. It's up to us to take action, to be proactive. So I wrote a couple of articles, and then I wrote something on Lyme disease. And that was, for me, that was the beginning. I was hooked on it. Lyme disease is something that I've been afraid of for a very long time for myself because I'm a gardener, I'm a hiker, I have a big compost pile, I love being in nature, and I'm always exposed. So I do have a protocol for protecting myself: clothes, spray for my clothes, for my skin, lots of garlic. I actually believe in that. It may be an old wives' tale, but I do eat a lot of garlic, raw as much as possible. I shower after I'm outside. Actually, this week I found something on me that I thought was a bite, and I used some homeopathic remedies, and I put clove essential oil on it, which is something that I have recommended to people. And then I decided that I really needed to get some doxycycline, because if you take that in the beginning, as soon as you find it, and the tick is there, that's the time to take it. That's the time to stop Lyme cold. There are also other things to do to protect your immune system, exercise, all of that. So doing this research has been a huge journey for me. I'm just learning about so many things, about evolution. Ticks have been around for maybe millions of years. I'm starting to look at disease. Where does it come from? All the diseases that we have now: fibromyalgia, MS, autism. Is it possible that it's from a tick bite, or are there parasites in the system? I have all these questions. I speak to people every day, and they all have something to teach me. I mean, I share my information, but every day there is somebody who tells me something that is unbelievable to me, and, you know, just helps me learn more, just opens my mind up. So I have been writing almost every day. Once a week I have a letter in the Woodstock Times. And then I decided to do this, to have a panel, to bring more people together, to share in a community discussion, because this does need to be a discussion, communicate between us. Some people may want to start a support group. There are many ways to deal with this and to get help and support. So we have two great speakers here tonight. Dr. Kathy Nolan is a medical doctor. She's been dealing with Lyme disease, helping people for quite a while. Eric Tischler from Woodstock Integrated Health is an acupuncturist. He is also able to diagnose people. He'll tell you more about that. He has a different way of approaching Lyme disease that is very successful. So Kathy is going to be the first one to speak. Okay. Thank you.
Hello, everybody. I'm Kathy Nolan, and I'm trained as a pediatrician and also in epidemiology and research design. Many of you may know me, however, for my role with Catskill Mountain Keeper. Catskill Mountain Keeper is a nonprofit that does a lot of good work in this area, and that's what I'm doing right now, rather than having a medical office. However, I have been drawn into working with people who have Lyme disease or Lyme-associated disease because they weren't getting what they needed from the medical system. And that started about 12 years ago when a friend of mine came down with a very high fever and headache and was diagnosed presumptively with Lyme disease after a full medical workup, got received IV antibiotics, had not only the headache and the high fever, but also had a paralysis of the facial muscle, which the Lyme organism can attack the small nerves in the head and face. His clinicians had no idea of how to help him, because at that time it was believed that if you had a paralysis of a nerve, that was untreatable. So I went to the internet and found some people who knew a lot about the microbiology of the organism that is responsible for Lyme disease. And that organism is a spirochete. It's a little bacterium that has a kind of corkscrew-like appearance, similar to some other bacteria that we know about, similar in the way that it is formed and the way that it works, not in the way it's communicated. The spirochetes are hard to treat. There's a spirochete that's responsible for syphilis. There's a spirochete that's, the bacteria that's responsible for tuberculosis is not a spirochete, but is similar in being hard to treat.
Please turn off your cell phones.
So these are hard to treat organisms, and the Lyme-related organisms, other organisms that are carried by ticks, are also hard to treat. And I think that modern medicine, Western medicine, allopathic medicine, hasn't been ready for them. I didn't mention that during my training I also studied the use of hypnosis for treating patients and treating children. And so I've always believed there are things beyond what allopathic medicine has to offer that we should be investigating and learning from. Allopathic medicine came from those roots. So I'm not an expert in some of those approaches, but I've always been willing to work with other people who are experts and let them help if they can. I came to see that what was happening in the treatment of Lyme disease is that a lot of the antibiotics that people knew would be effective against this organism, clinicians were using as if the patient had a head cold or an upper respiratory infection. Doxycycline, for example, is used in doses of 100 milligrams twice a day, 200 milligrams a day, and that will normally take care of most upper respiratory infections. However, in the laboratory, in a test tube, that's not a sufficient dose for these organisms, which are harder to treat.
What is the proper dose?
So a proper dose, it would be a minimum of 300 milligrams a day, and if patients can tolerate it orally, up to 600 milligrams a day. I've not yet found a patient that tolerates that, but the patient that I told you was my first introduction into trying to find something better for Lyme needed 500 milligrams a day, and on that dose, he tried 600 milligrams a day, but he couldn't tolerate it. But on 500 milligrams a day, his facial paralysis went away. And so I was pretty impressed that the people who were really studying the microbiology of this were onto something. So those folks, I created a list of resources for you, and those folks are often referred to as Lyme literate clinicians. And the Lyme literate means that they've really studied this and looked into the organism, the microbiology of the organism in a different way than even the Centers for Disease Control. The reason that a lot of clinicians don't treat the way that these Lyme literate clinicians recommend is that the CDC, the Centers for Disease Control, did a study and looked at the research and saw that if you're taking 200 milligrams a day of doxycycline and you take it for long periods of time, it doesn't seem to make any difference than if you just took it for 30 days. Well, this to me makes sense because the 200 milligrams a day is an inadequate dose, and so you're not going to see much difference whether you treat a long time with an inadequate dose or a short time with an inadequate dose. I think if those studies had been done with higher treatment doses, we might see much more of a difference. Also, there's probably a mixture of people who actually are infected with the Lyme agent and people who have something else. And so it can be very hard to show efficacy of your approach, of your treatment, if you've got people in who don't have that infectious agent. They might even have another tick-borne disease, but if it's not a tick, it's not an agent that's susceptible to doxycycline or the first-line drugs for Lyme, then you're not going to see a response. So my feeling is that there is the biggest place where we can approach Lyme is at the level of public health measures, like simple measures like showering immediately from coming inside and really getting in touch with ourselves, literally in touch. We need to touch our bodies so that we're finding these little, almost like grains of sand type ticks that we might otherwise miss. If the tick is on for a short period of time, there's less exchange between the tick's intestinal system, if you will, and our bloodstream where they've dug in. So the guideline for a while had been that if a tick was less than, on the skin for less than 72 hours, with very low risk of infection. And that's probably true, but some studies in animals and now in humans suggest that it's not 100%. But the sooner you get a tick off the body, and these are the little deer ticks, not big dog ticks, the sooner you get the tick off the body, the better. And the
24 hours is?
Well, 3 hours is better than 6 hours is better than 12 hours is better than 24, 48 is better than 72. 72 and after, then I treat that as a presumed exposure after 72 hours. I'll come back to that of what I recommend if you have the tick on for any length of time. The other thing that can be important is how you get the tick off. A tick remover like this one was $4.99. That's one of the most expensive I've seen. A bunch of places are giving them away free, Ulster County Department of Health. It's a little device that lets you slip it under the tick and twist and pull without squeezing the tick. Much better in terms of not disgorging the tick's contents. If you don't have one, I recommend you get one of these. If you did nothing else after this lecture, you have one so you can help your neighbor and so forth. That would be a very effective outcome from your having shown up here tonight. But if you don't have one of these, a pair of tweezers that you grab just behind the head, between the head and the body if you can, just where it gets thick, and then remove with that. Much better than with your fingers or putting Vaseline or burning or anything else you might try. So just try to remove the tick so that it doesn't have a reason to disgorge its contents, including whatever bacteria it's carrying, into you. So you do that. You remove the tick effectively, and you don't know when you got the tick, maybe in the last 24 hours since your last shower. Should you do anything else? I think that's really, at this point, a matter of personal preference. After 72 hours, I recommend treatment with a short course of doxycycline in at least 300 milligrams a day. And short course could be 2 or 3 days, and especially if we think that it might be 48 hours or 24 hours instead of 72 or more. The longer that we think the exposure might have been, between exposure and finding the tick, the more antibiotics for a longer period of time I would recommend. And some people recommend, clinicians who haven't learned about the 300 milligram minimum would recommend 200 milligrams for 3 weeks. It's an art at this point rather than a science because we don't have good studies of what really works the best. For people who don't want to take Western antibiotics, herbalists recommend astragalus at 3,000 milligrams a day with a dose of 1,000 milligrams a day recommended on an ongoing way just to stimulate the immune system. So I'm not an herbal practitioner. I can't speak to how well that works, but that is an option. Another option is just watchful waiting, and what can happen then is person goes along and develops a flu-like syndrome within a week to 10 days of having had a possible exposure. I consider that, even if it's just a cold or the flu, really, I treat it as if it's a Lyme disease infection, because it could be, and they had a tick exposure. Then I recommend at least a month of antibiotics. Similarly, a bullseye rash that you've heard of, I've seen bullseye rashes. If you have one and a health practitioner sees it, it counts as a diagnosis of Lyme, even if you don't have a positive serum antibody level. It's important to let your clinicians see a rash, but most of the rashes I've seen for Lyme do not look like bullseyes. They're atypical rashes. So watching for that rash over the period of a couple of months after a tick exposure is another approach. If the Lyme is not diagnosed and not treated at that early infectious stage, it can settle in, and then you get the things that people associate more with Lyme disease. Inflammation of the joints, cognitive problems, potential effects on the cardiac system. Those are much harder to treat, but I believe not necessarily untreatable. They do require, in my experience, a large amount of Western medicine, and I usually recommend additional either herbal support or support through Jinshinjutsu, which is an energy healing technique that I have used and recommend. There are many ways to stimulate the immune system. The immune system is our friend in this. And so anything that an individual has already found to support their own immune system is very good. The Jinshinjutsu may be similar to a Qigong approach that somebody might use in an ongoing way. In addition, this organism seems to put people in a place where I believe they need to really get in touch with their spiritual being. It's kind of the silver lining of having a Lyme infection. It really affects all of the connective tissue of our bodies. And the connective tissue is what lets us be upright, holds us up. And so something that affects that, you really feel it. You really, really feel it. And people can be very, very sick with this infection. What seems to be true is that anything that is hard for our bodies to deal with, it is much more amplified in a person who has Lyme or a Lyme-associated disease, one of the other tick diseases. So refined sugars, bleached flours, anything that tends to cause the insulin levels in the body to fluctuate. I've seen people who are doing very well with a Lyme infection and go to a birthday party and be sick for a month and a half. So alcohol, caffeine, all the things that you would have to give up if you went to live in a monastery, that's what I recommend for patients that have Lyme. Caffeine is, I do because some of the folks on my list who've given me good advice, you know, some of these references that I've given you here, they say no caffeine. I'm not sure if it's things that make the body acidic, but it may be that the acidic quality of things is what's going on there, and so caffeine would fall into that category. So let me do this. Let me finish, and then we thought we'd let Eric speak a little while, and then we'll take questions that might overlap between what we're presenting. So I do think that it's possible to have effective interventions with Lyme. Not every clinician has looked at these issues very deeply, so I recommend that if you have Lyme yourself, think you have Lyme, or have a friend or family member that has Lyme, that you look at some of the materials on the International Lyme and Associated Disease Size website. That's ILADS, ILADS.org. I brought a few printouts. If there's anybody here who doesn't go online and it's going to be hard for you to get that, I'm happy to give you some of the basics. I have a little brochure about top 10 tips to prevent chronic Lyme disease, and the ILAD's evidence-based guidelines for the management of Lyme disease. I don't have enough to give out to everybody, so if you'll let me know afterwards if you have trouble getting those, and I'll give you one. If we run out, we'll print some more for people.
Could you say that again? What is it?
ILADS. It's the International Lyme and Associated Disease Society. And I think of them as the good guys, and my mnemonic for it is, "Aye, lads!" If you've got Lyme, you want the "Aye, lads!" You want the Irish folks helping you here, although they're not Irish.